Hi, today we're going to talk a little bit about how to avoid low back pain when bending. Low back pain is a really common problem that we see in our office, and there are some really simple cues and little tricks that you can use to help reduce the stress on your low back and avoid those painful situations like bending to get something out of the dishwasher or bending forward to brush your teeth. These sort of things seem so simple, but every time you aggravate your back that way, you're making it a bit sore, a little more sensitive. So if we can keep those things at bay, you'll be happier and your health will improve quicker. So let's have a look at some of the common problems. The first is that the back flexes a lot. So when you bend a low back, if you bend more from your upper body and then you let your low back arch, you're actually putting a lot more stress and leverage problems onto the lower back joints. On the way back up, you're also recruiting your lower back muscles to straighten the spine and bring you up. That's quite hard on them, whether it be you've strained the muscle of your spine, whether the facet joints in the low back are sore, or whether it be a disc problem. These can all cause some irritation. So one of the easiest answers is a thing called a hip hinge. And that basically means we're going to use our hips to bend, not our knees so much, although the knees will bend slightly, but more from the balls and sockets of our hips. If you look at when I bend this way, you'll see that I can keep my low back in a fairly neutral position, and as I push my hips behind me like that, my spine is actually staying in a relatively neutral spot. This means that I can do simple tasks like washing my face and brushing my teeth and getting things out of the cupboard without actually having to move my lower back. It's actually just the hips that have bent. An easy way to test yourself is using something simple like a broomstick. You can pop it along your spine, pop your hand in the gap in the low back here, you let it touch your mid-back and you touch the head as well. In that position, you just stand with a slight knee bend. Your knees don't go any further forward than your toes at any time. And what you'll need to do is get an idea of whether you can bend forward and yet still keep that stick touching every part of the spine. If you do have a problem with this, you may find that you'll bend your upper back. Or in some people's cases, if they go down, they're trying to keep themselves too straight. They actually lift their chest too much. That can give you pain as well. One of the other things that you'll find is that you need to get used to shifting that weight backwards. That's where a simple test where you stand just 30 centimetres or even 20 centimetres away from the wall with both feet just positioned comfortably, shoulder width apart. What I'd like you to try is get used to bending the knees just in a small little fashion like this, and I want you to try to get that hip to hinge back and touch the wall. Now as you do that, this looks remarkably simple, and it really should be. But often you'll see, I see clients that stand there and bend like this and they don't touch the wall at all. They've got no shift of their weight backwards. This loads up their spine, gives them more chance of pain. And if you get used to doing something as simple as this and practice that movement, you're going to find it's good for your hips, it's good for the strength of your glutes, and more importantly, it can help you avoid low back pain. So this is a common task that we do every day, sitting in heavy chairs, getting up and down out of the car seat, off the toilet, when you bend to pick up groceries, or if you're a mum or dad, just bending down to pick up the kids. This is something you can use every day. So try it out. It may be hard at first, but it gets much easier. And the more you do it, the better you'll move.